Hello and welcome to another episode of Doctor vs. AI with me, Dr. John Stelmach, orthopedic surgeon, private practice for 34 years, 40 years of experience, specializing in hip and knee replacement. And how this works is I'm in my self-driving Cybertruck, and since I really don't do a whole lot, I sit here and what I do is I'll ask my in-car AI assistant, Grok, a question that a patient will ask me, and then I'll ask it, it'll give me an answer, and then we can talk about it and see what I think. So let's get started. Hey Grok, I saw my doctor. I'm 65 years old and I have a bad knee, and he says I need a knee replacement. Then I found out that my neighbor said that some people do it with a robot or something, and then other people do it by hand or manual. I'm not sure what that means. Is one better than the other? What should I be worried about?
Robotic knee replacement uses a robot to guide the surgeon for more precise implant placement, while manual is the traditional hands-on method. Studies show robotics often gives better alignment and sometimes quicker recovery or higher satisfaction, but long-term pain relief and function are usually similar between them. Main worries for any knee surgery at 65 include blood clots, infection, stiffness, or implant loosening over time. Plus, risks rise with things like diabetes or obesity. Chat with your surgeon about your health and their robotic experience to pick what's best.
Well, that was good. That was a nice generic answer. The robotic knee surgery, basically what it is when a knee replacement is placed, a knee replacement is a way to recap the ends of the bones. And the traditional way of doing that was by hand, where we'd have external measuring guides and things that were just mechanical that you'd put on the leg and do the bone cuts. And with your experience and whatever, you would try to get those parts positioned properly so the knee would balance and go through a full range of motion and be balanced at the same time. That's always been a little bit of a moving target. I always call it a kind of an art project because it takes a lot of judgment, a lot of not guessing, but kind of figuring out what the best technique would be. Because we cut the parts and put the parts in trial and have to change things, which is never really the best way to do it, but that's the only way we had to do it. You could get good results with that. Nowadays we have the robotic total knee replacement. What that means, it's not a robot doing the surgery. What it is, it's basically software. What we do is we get a scan of the knee, get a three-dimensional model, let's put it in the computer, and we can formulate a plan not have to do any cutting on you. We can get the plan, move your knee around, and your knee generally spends most of the time just sitting there while we're doing the surgery. You don't have to move it around a lot and twist it and that sort of thing. And then once we have the plan and it seems like it's balanced perfectly, what we do then is there's a robotic arm, which is like those robots in the factories, that are building cars. It's basically that. I guide it, but it cuts the bones exactly what we planned in the computer. It's very reliable. I've done this surgery thousands of times. I have never changed one plan. So the results of that are a couple things, and I'm surprised to hear the computer actually say this, is that the long term, the results are the same as a standard knee replacement, and they can be, but what I've found doing robotically, the long-term results, more patients now say that their knee feels like their own natural knee than it did when we did it by hand, because we could put the parts in exactly. So that's a game changer. Patients are much more satisfied with that. I mean, we would occasionally get a patient who says, oh, my knee feels normal, but you couldn't hit it every time. And the robotic measurement with the computer, you cannot do it by hand like that. So it gives you really your best chance to every time hit the right spot. The other benefit of the robotic knee is the fact that we don't have to really see it because we're seeing it through the computer. So that allows me to not use a tourniquet, which is better for your swelling after surgery. It's a little counterintuitive, but it's better for your swelling after surgery. The other thing that we can do is there's a lot less incision inside of your knee, because the knee is involved with a lot of ligaments in the knee, and ligaments, when they're operated on, are very, very painful. Ask anyone who's torn a ligament, it's very painful. So we don't really have to do much with that to be able to expose the knee, because the robot has actually controls where it will not let me cut outside of the bone. If I'm doing it by hand, I can go outside of the bone, so we have to protect you, but doing the robot, we don't. So in my experience with doing the robotic knee for 7 years now is the fact that patients get better quicker because it's less trauma to them. There's less swelling because we don't have to use a tourniquet, and a lot of less manipulation. The balance of the knee is really perfect every time. And overall, it's really an improvement. I'm glad to hear from what the robot said that it's actually starting to catch on and be more mainstream, that it is better. Intuitively, I know it's better. As soon as I did it, I knew that was going to be the way to do it. So, and the other thing just to remember again is that the implants that I put in manually, the parts that we put in your knee, are the same whether it's robotic or it's by hand. And the precision of the robot, you just can't beat it. And she didn't mention, but the time of it, people were, oh, it takes so much longer. No, it doesn't. It doesn't take any longer to do it with a robot. I've gotten a lot of experience, and you can really do it. A knee replacement, a regular knee replacement takes about 30 minutes. And that's all it takes. And by hand, I could maybe do it quicker, but not really. And what it does do, if you have a very difficult knee or a big person, it's much more surgery, they take 30 minutes. Because there's no mistakes, do the surgery, put the parts in, we're done. We don't have to check or trial it or anything. It's really a game changer. Now, surgeons are not going to agree with me, but the robotic surgery is much more precise. So the complications of surgery and that sort of thing, that's a different episode. Did mention that, but anyway, so hopefully we learned a little bit today. And computer, again, gave us some information, but not all the information. And we'll see you the next time on Doctor versus the Eye. Please like and subscribe. Send me an email if you'd like to see different topics. And talk to you later. Thank you.